1 2 1 2. Check 1 2 1 2 1 2 1 2 1 2.
One, two, one, two, one. Mic test, 1, 2. 1, 2, 1, 2. 1, 2. 1, 2. One, two. Mic 1, 2.
Si pale mbele. Uko na stand yako? Uko na stand? Tutazika tu zote mbili, tutazika on zote mbili. Ndio hao wapate kutoka kwa mic yao. Kamera simu. Nini? Sawa.
So no, these things, Anyway, we have the capabilities within the test yesterday.
One, two. 1, 2, 1. 1, 2, 1, 2. 1, 2. Mic test. 1, 2. 1, 2, 1, 2. 1, 2, 1, 2. One, two, one. 1, 2, 1, 2. 1, 2, 1, 2. 1, 2. Like this. 1, 2. 1, 2. 1, 2. 1, 2.
Check, check, 1, 2, 1, 2. Check, check, 1, 2. Check, check, 1, 2, 1, 2, 1, 2, 1, 2. Mic check, 1, 2, 1, 2. Check, check, 1, 2.
One, two. 1, 2, 1. Make this 1, 2. 1, 2. Mic test. 1, 2. One, two. Mic test. 1, 2. Hello, hello. 1, 2. Mic test. 1, 2, 1, 2. 1 2. 1 2 1 2. 1 2 1 2. 1 2 1 2. Make test 1 2 1 2 1 2 1 1 2. 1 2 1. Iko sawa. 1 2. Mic test 1 2 1 2. 1 2 1 2 1 2. Mic test 1 2. 1 2. Mic test.
Check, check. 1 2 1 2.
Jamsha mtu. 1 2 1 2. 1 2 1 2. Mic test 1 2. Iko sawa. 1 2.
Check, check. Check 1 2 1 1 1 1.
1 2 1 2 1 2
1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2
1, 2, 1.
Check 1 2. Check 1 2. 1 2.
One, two, 1, 2. Mic test 1, 2. 1, 1, 2. Mic test 1, 2. 1, 2. 1, 2, 1, 2. 1, 2. One, two, mic test, 1, 2, 1, 2, mic test, 1, 2, 1, 2. One, two, 1, 2, 1, 2. One, two, 1, 2. One, two. Mic test 1, 2. One, two, 1, 2. One, two. One, two. One, two. One, two. One, two. 1, 2. One, two. One, two.
The 13th Ministerial Igad meeting in Mombasa.
Okay, that's fine. Thanks.
Kidogo tu alafu nitatoka.
One, two. One, two, 1.
Check, check, 1, 2. Check. 1, 2. Testing, testing, 1, 2. Checking table mic. Check, 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 check. 1, 2. 1, 1, 1, 1, 2. 1, 2, 1, 2, 1, 2, 1, 2. Up.
1, 1, 2, 1, 2, 1, 1, 1. 1, 2, 1, 2, 1, 2, 1. 1, 2, 1, 2, 1, 2, 1, 1, 2. 1, 2. 1, 2. 1,
Good morning, everyone. Ladies and gentlemen, please let's settle down. Please sit on your designated seats. Everybody, whoever is standing, please let's settle down. Let's get, so we can start the program of the day. Welcome all. Everybody come in. Whoever needs to be, everybody needs to settle down on the designated areas. Let us all sit down. You'll be guided by the admins. Inquire for Mohammed, Saida. Okay, guys, let's settle down. 1 2 1 2 1 2 1 2 1 2 1 2 1 2 1 2. Is it here? 1 2. But it's okay, huh?
Yeah, it's okay because I've muted your microphone. So
Yes. Okay, so there will be no echo. 1 2 1 2.
Hii sound iko nini kwa mama? Yeah.
1 2 1 2.
Bado nakuja tu side moja.
Good morning, everyone. Good morning. Welcome again. Let's settle down. We're about to start very soon, in about 10-15 minutes. I hope you all slept well. You're all looking very beautiful, very nice. Very beautiful ties, looking very nice. This is very good. I hope you're enjoying the heat. It's not too hot, yes? It's good weather? Good. Walked around Mombasa? Good. So welcome to the 13th Ministerial meeting. We're about to start the proceedings. The distinguished delegates will join us soon. Please look to your left and right, introduce yourselves to your neighbors. There's a lot of social networking that will go on here, and it's a lot of social value for all of us. And it is good to get to know each other. So please welcome. We will be starting shortly. My name is Dr. Bashir Ahmed. I'm with the Igad Secretariat, and welcome to this 13th Ministerial meeting. Thank you. Dear all of you, please welcome. Please settle down. Everybody who needs to be designated, please settle down. Good morning, everyone. Please let us settle down. We are about to start proceedings. Thank you all. Everyone to please settle down. Thank you. Thank you very much. I'm going to invite Dr. Fatuma Adan, the Master of Ceremony for today.
Thank you, Dr. Bashir. Thank you. We would like to bring the meeting to order. Thank you for taking your seats. Your Excellency, Dr. Warkane Gebeyehu, Igad Executive Secretary, our host, Minister, and guest of honor, Excellency Honorable Senator Mutai Kagwe, Cabinet Secretary, the Ministry of Health Kenya, Honorable Ministers from the Igad member states, distinguished Director Generals, Directors from the respective ministries, ambassadors, undersecretaries, colleagues from the Igad Secretariat, the media fraternity represented, all protocol observed. I want to welcome you to the 13th Igad Health Ministerial meeting here in Kenya, Nairobi, Mombasa, at the Serova White Sands Hotel. I would be briefly your MC, and I'm equally honored to do that piece of work. Without further ado, I want to welcome Madam Fatia Alwan, Director Health and Social Development, the Igad Secretariat, to give her remarks, and invite Her Excellency Dr. Warkane to give his remarks. Thank you. You can talk from.
Good morning. Thank you, Dr. Fatima, our MC. And also a very good morning and bonjour, salamu alaikum, to all our honorable ministers, our executive secretary, ambassadors, our delegates from the respective countries, our partners, and also my Igad colleagues. I will not say much because I know that many has been done during the last 3 days. Excellencies, we are very happy actually to have this third ministerial meeting of health focusing on issue of refugees, displaced migrant, and host community. And as all of you might know, this segment of population has been within our agenda since we have established the Igad Health Desk within our organization. They have just removed one photo where we have actually all the head of state from the Igad region in 2017, actually what we called was a Nairobi Declaration. Nairobi Declaration actually is a regional application of the Igad Global, of the Global Forum actually for refugees that has been actually commonly applicated to our region. And since actually we are dealing the issue of health in our region, the Igad mandate has been only focusing on the cross-borders population, including refugees. And why? Because this is also our citizen, and what we want is how also these people will be included in the national plan of our respective countries. Excellencies, I will not take much, but just the objective of the Nairobi Declaration that has been endorsed by the head of state in 2017 actually has recommended that Igad to organize a ministerial meeting on how to address the issue of health for refugees, host community, migrants, and IDPs. And this is the reason today we are here. After actually having the expert meeting of the 3 days, we have also put it for your committee to be tabled in your today to endorse actually the recommendation of the last 3 days of expert meeting. Excellency, I will not take much, but let me invite my boss, His Excellency, Dr. Warkane Gebeyehu, to deliver his speech on behalf of the organization. Thank you, Excellency.
Thank you very much, Madam Fatia. Before I start my formal speech, let me take this opportunity to thank my team who really did a very great work to make this meeting is real, and also in front of our member states, Excellency Ministers. Please give them applaud for this very bringing all them together. Thank you very much. Your Excellency, our distinguished host, Senator Mutahi Kagame, Cabinet Secretary for Health, Republic of Kenya, Honorable Abdullahi Ahmed Robale, Minister of Health, Republic of Djibouti, Excellency Dr. Leah Tadessa, Minister of All Health, Federal Democratic Republic of Ethiopia, joining us virtually, Dr. Fauzia Abikar, Minister of Health, Federal Republic of Somalia, also Her Excellency is joining us through video. Victoria Aniba, Permanent Secretary, Republic of South Sudan, Ambassador Majid Ahmed Mafde Al-Nur, our chair, representative of our chair Sudan, Honorable Hanifa Kawoya Bangirna, State Minister of Health, Republic of Uganda. All protocols are observed, especially Dr. Ahmed Ogawe, Deputy Director of African Center for Disease Control. Ladies and gentlemen, my colleagues, allow me to begin by thanking you for making time to attend this, the 13th session of the Igad Health Ministers meeting on regional health initiatives in our region. As I was traveling here to join you in this meeting, Your Excellencies, I had time to reflect on the importance of health, not only from the personal perspective, but also from where we all sit as a custodians of public policy. And in my reflections, it occurred to me that healthy citizens are the greatest asset any of our countries can have. Indeed, when I cast my eyes around the world, it was evident that the wealthiest countries are the healthiest countries. I am therefore honored and grateful to host you all on this meeting where we can deliberate on how to collectively grow the health capital of our states and people. Our discussions come at a time when we are coming to terms with a post-pandemic world. I'm not very sure that we are now in post-pandemic. The professionals can conquer or disagree on this thing. It's also come at a time when we are also grappling with the effect of many other political and ecological diseases. In the shape of conflict and insecurity here in the Horn of Africa, as well as Europe, drought and flooding, and also pest invasions. Today we shall be laying firm foundation for the future of health policy in our region by endorsing a number of regional policies and strategies, as well as program recommendations that we approve in the 2021 Health Steering Committee meeting held here in Mombasa. We know that when our people are on the move, diseases also move with them. This meeting is in recognition that our regional integration agenda also has implications on the health of our region. And we need to put to place measures that respond to the concerns arising in our region as well as in the continent and beyond the continent. Excellencies, ladies and gentlemen, as Igad, we have always mentioned that borderlands are the traits in which the future of our region will be decided. But at the same time, our borderlands have some of the lowest level of health, economy, and social infrastructure. Our cross-border mobile population faces significant challenges in accessing to basic health needs, and this has negative effect on the regional economy and undermines the health security for millions of our citizens in the region. However, I am also encouraged by the spirit of brotherhood and sisterhood that our countries share and the informal health integration that is already in place. In July of last year, I was privileged to visit the confluence of 3 of our member states, that is Kenya, Ethiopia, and Somalia in Mandera. When I saw the communities in that region share the same healthcare facility in Mandera towns, which is in the side of Kenya. I also noticed that they are facing a significant infrastructure challenges in getting across the border because of this, because there is no bridge spanning the river Omo. I want to take this opportunity to once again appeal to the authorities to assist in facilitating the resolution of these challenges. And I can assure you also, Igad is doing its best to bring these 3 communities as a part of regional integration through health integration. I put my Igad Health Missions in all countries at your disposal to coordinate this matter for the benefit of our people. Excellencies, dear participants, the COVID-19 pandemic showed us how vulnerable we are not only health-wise, but also politically and economically. In January of this year, I was very concerned by the pillar up on the tracks that stretched over 140 kilometers on the northern corridor between Kenya and Uganda, because we had to contain the spread of COVID-19 through mandatory testing. In protecting our people, we unfortunately had to hurt our economy. Similarly, we are yet to harmonize our pandemic policy in the region. Our mobile population still has to be tested for COVID-19 before they depart and when they arrive at the destination in our region. While this level of diligence is admirable in protecting us all from infection, it is also a vote of no confidence in each other's health systems. We need to demonstrate that we trust each other in health matters also. In this regard, Your Excellencies, I urge all to come together and have common and regionally recognized health standards that will ease the movement of the people and remove non-tariff barriers to their economic growth and prosperity. As we now transition into the post-pandemic, I want us to look back and ask ourselves 2 fundamental issues. Number 1, have we sufficiently capitalized on the crisis to seize the opportunity to strengthen our national and regional healthcare system? Are we ready to the next health challenges that will affect our region? These are the most important challenges that the health professionals you are going to face. I am gratified to note that the expert discussion which preceded this meeting and the declaration we are going to issue on cross-border health initiatives in Igad region will go a long way answering these questions and contribute to our shared objectives to attain universal health recognition. As Igad, we shall continue to support our member states to address the health needs to the underserved rural cross-border populations, refugees, and host communities. and commit to work closely with existing cross-border health systems. From a policy standpoint, we have a number of regulatory instruments already at our disposal to improve the health security of our most vulnerable population, and I will draw your attention to 4 of them. Number 1, Igad Regional Health Data Sharing and Protection Policy. The second one is Igad Cross-Border Health Policy, that is 2021 up to 2030. The third one is Igad Regional Maternal, Infant, and Young Child Nutrition Advocacy Strategy. And the fourth one is Igad Regional Knowledge Management Strategy for Health. I call upon all member states to join hands in implementing and delivering on the mobile intention of these policy instruments so that we can unlock, catalyze, and capitalize on the latent health assets are already inherent in our populations. Your Excellencies, dear participants, as I come to conclude my remarks, allow me to express my sincere gratitude to all the experts from the Ministers of Health in all our member states, our development partners at the European Union, UNHCR, and refugee commissions for the continued technical and financial support that over the last 3 years, which has been vital for the formulation, validation, and endorsement of the policy documents that are going to be presented in the 12th Ministerial meeting. I also take this opportunity to sincerely thank Your Excellencies, our partners at the European Union, African Development Bank, Sweden, and Turkey for supporting the Igad COVID-19 regional response strategy, complemented our member states' response to the pandemic. Finally, I extend my sincere gratitude to the government of Germany through the GIZ, the Global Fund, and the European Union, and that for the financial and technical support that made a high-level expert meeting and this ministerial gathering possible. Last but not least, ladies and gentlemen, join me in appreciating the government of the Republic of Kenya, and specifically Cabinet Secretary Senator Kagwe, he's a friend of Igad, for accepting to host this meeting, and also for support they have given to us collectively improve the health status of our people. Thank you very much.
Thank you, Excellency. Thank you for Madam Director for those words. Excellency, I think you've brought, our attention back to the glaring issues that our member states and Igad as a secretariat need to put together to improve our health security and specifically improving our health outcomes in our population. With that, I want the House to look at the agenda. We have an agenda, a draft agenda, or a program in front of each and every one of us. We have a bit of adjustment, not very major. We want to share those adjustments, but however, we have colleagues online. The Ahmed Abdullahi communication team, please confirm if the EU ambassador is online. We want to recognize, if you look at the screen, we have quite a number of colleagues from the member states. We are glad to note that Dr. Leah Tedessa is online. Dr. Fauzia Abikar will also join us. Dr. Leah Tedessa is the Minister of Health, Federal Republic of Ethiopia. Dr. Fauzia from the Ministry of Health, Somalia, would be joining us online. If EU ambassador is online, we would like to give him or her the opportunity to make. We do understand that they have not joined us. We look forward to, having them the opportunity if they want to make their remarks. Before I hand over before I give the opportunity to the chair to make his remarks, we have an adjustment so that we are able to complete this process in time. We will not have a coffee break. We will have our coffee break at the end of the program. So with that, we also want to have Africa CDC and EcoCare make some statements. We want to hear those, the discussion we've had from you on the technical meeting in this plenary, so that you tell us how do we improve our health systems. With that, since we don't have the EU ambassador online, I would like to invite Igad chair, the government, the Republic of Sudan, to give his remarks. Excellency, welcome.
Okay, thank you very much, dear sister. Bismillah ar-Rahman ar-Rahim. Your Excellency, Senator Muthai Kagwe, Cabinet Secretary of the Ministry of Health of the Republic of Kenya, Honorable Ministers of Health of the Igad member states, Your Excellency Dr. Warkana Jibriyehu, the Executive Secretary of Igad, our partners from the media houses, our development partners, experts from the different institutions of health in the region and from the ministries of health. Ladies and gentlemen, all protocol observed. It gives me great pleasure to address this very timely and important meeting of the 13th Igad Health Ministerial Committee to deliberate on issues of health and security health in Igad region on behalf of His Excellency Minister Haitham Muhammad Abdullah, who was not able to attend this meeting for prior commitments. He is sending his greetings and best wishes for successful deliberations for all of you. Also, I would like to start by thanking our host, the government, and the people of the sisterly Republic of Kenya for the hospitality accorded to all the delegations since their arrival in this beautiful city of Mombasa, and also for hosting us and facilitating our mission here at for the technical meetings and also for this ministerial meeting. I would like also to thank Igad Secretariat, led by His Excellency Dr. Warkana Gibriyehu, the Executive Secretary, and the Igad Department for Social Development and Health. Also, I would like to thank Igad's heads of missions for their contribution to these meetings. Also, I would like to thank our partners from the development partners from Africa and overseas. The African Development Bank, the CDC, the African Union, the European Union, World Bank, UNHCR, and other specialized UN agencies for their valuable support to Igad and for Igad countries, and also for their valuable support to different Igad initiatives. Also for their support that enabled Igad to have this 13th meeting of the Health Committee. Also, I would like to thank our partners from the different media outlets who are honoring us by their presence here at this opening ceremony. Also, I would like to thank the management and staff of Sarova White Sands Beach and Resort Hotel for their support and facilitation of this region, of this meeting. I would like also to start by thanking the technical teams for a mission well done in the different initiatives of Igad in the health sector, whether on health and nutrition, COVID-19 regional response plan, health policies and digital health, One Health and regulatory harmonization, Igad knowledge management strategy, Igad maternal, infant, and young child nutrition, Igad regional malaria control and elimination, and for their very hard work in the last 2 days, which enabled us to have the draft ministerial declaration that is going to be signed at the end of this meeting. I would like to thank each and every one of them for this very valuable contribution. I would like also to shed some light on a very development at the international level that may have a negative impact in our region, especially on the vulnerable population, IDPs, refugees, immigrants, and which is the current unfolding conflict in Ukraine, which we have already started to feel the heat of this crisis in our region. We think that this crisis is going to impact our region in different ways. The first one, in diverting the attention of our regional and international partners away from our region. And this is why we call on our partners in the region and the international community to continue supporting us at this very difficult time. The second impact of this crisis on our region is going to be in the increase of oil prices and the subsequent inflationary pressures that we have started to feel. This one is going also to impact the most vulnerable groups in our societies. The third impact is going to be on the pressure on food and nutrition. Even some observers and international organizations are warning from some sort of a famine or food security crisis in different parts of the world, and particularly in Africa. This is why we think that this meeting is very timely, and we need to put our hands together and to strengthen our cooperation in the coming months and year in order to prepare our region for a very delicate and very challenging environment, whether in health, nutrition, food security, or other emergencies. Also, we have to take into consideration the fact that our region, apart from this new crisis, we are suffering from other crises which are negatively impacting our health system and our vulnerable population. We have political instability and conflicts in some member states of Igad. we have drought and desertification, which is impacting our food security in the region and also impacting our economies. And also we have the issue of desert locust, also which is have a direct impact on our economies, our social development, and our health system and nutrition. This is why we think that we renew our call for our international partners to pay special attention to the situation in our region, and the fact that Igad region is one of the most impacted region in Africa. We need them to strengthen their appreciated support for us so that together we can surpass this very difficult and challenging environment. We think that through our work together, we can build a better future for our children and a better future for Igad region. And also we can, through strengthened cooperation, we can achieve the dream of a prosperous, peaceful, and integrated Igad. We need to increase our efforts in building the capacity of our health institutions, research institutions in the health sector, and also to build the capacity of our human resources in the health system in order to prepare our region for the emerging and for the current and emerging challenges. We need also to strengthen cooperation in order to implement the strategies that have been adopted, starting from our regional response plan for COVID-19. Also, we need to put more efforts in order to maximize the utilization of our medical and health personnel in the diaspora from Igad region in order to move to be ready to address this very challenging environment. Ladies and gentlemen, with these few remarks, I thank you all for your attention and wishing all of you fruitful deliberations and very successful meeting. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Ambassador Magdi, for those remarks. We too do take note of the issues that has been raised by the chair, the impact of the several disasters that are happening in our region. In our discussions at the technical experts meeting, we did note out the impact of drought, floods, locust infestation, the COVID pandemic, political instability on our public health sector, and the resultant, implication on our health security and thereafter the impact. So we do appreciate those concerns, and we hope this would be captured in our declaration of the 13th Health Ministerial meeting. We want to find out if the EU ambassador is able to join us, has joined us. I do take note and recognize the presence of the German government through GIZ, our technical institution, Africa CDC, and the EcoCare. We would also be giving you an opportunity to give us some remarks. So communication, do we have the EU ambassador? Excellent. Excellency Ambassador, I hope you are able to hear us.
Yes. Good morning.
Good morning,
I hope people
Ambassador.
can hear me. Okay. Listen, thank you very much. Good morning to all their excellencies, the ministers, and to Dr. Workina, my good friend, the Executive Secretary as well, and to all the guests there. I'm going to be very short this morning. I really do appreciate the invitation just to say a few words, and I promise not to keep people very long. From our perspective, we're very pleased to see that our EU Igad COVID-19 regional response is at the top of the agenda today. The pandemic was a rude awakening for all of us, but I think it's taught us how important it is to tackle public health issues on a regional basis. And our joint €60 million programme has demonstrated the value of a regional response, and it's shown us the value added of coordination itself. It's reached over 6 million people by providing relief to vulnerable groups, especially migrants and cross-border communities. It's kept trade corridors open and supply chains safe. And we've applied a lesson learned during the Ebola outbreak in West Africa by bringing digital health solutions to the fore. So I think Igad, the ministries of health across the region, our partners, all of us can say that this has saved lives. And I hope that the lessons learned from the EU Igad COVID-19 response can be applied to other healthcare issues. The digital component is a case in point and should serve as a pioneer for the cross-border data sharing framework that you'll be talking about later. The health crisis was high on the agenda last month at the European Union African Union Summit in Brussels. The European Union has already donated over 3 billion to COVAX, and at the summit we committed to delivering at least 450 million vaccine doses to Africa by the middle of this year. We'll mobilise another 424 million euros to ramp up the pace of vaccination here in the continent, and we agreed a common agenda last month for manufacturing vaccines in Africa. And interestingly, the European Union and the African Union have been committed to engaging on a comprehensive WTO response, which will include trade-related and intellectual property aspects. And indeed, some progress has already been made on this since the summit itself. Separately, it's good to see that you'll be adopting recommendations on health for refugees. The European Union is investing heavily in the Horn of Africa in the context of the Comprehensive Refugee Response Framework, and access to refugees to public health services and public services, such as education and health, is at the heart of what we, like you, want to achieve. The protection of refugees is crucial, so thank you for translating this into action through the recommendations on the agenda today. The nature of the European Union's engagement with Igad is changing, and we call the new approach policy first. And by that we mean more of an emphasis on policy coordination and the policy formulation that you're engaged in today. So let me finish by wishing you every success in your discussions and assure you that the European Union will not be far from the table, because we believe as fervently as you do in the regional integration that is at the heart of Igad's mission. Thank you very much.
Thank you, Ambassador. We as IGAD member states do appreciate, do recognize the EU's support, investment on several sectors and specifically on health. We do recognize and understand the support that EU has put in place in the COVID-19 pandemic for this region. The Refugee Health Program and the protection of refugees, which is driven by the IGAD Secretariat through the support of our member states. We continue to count on your support. We continue to work with the EU so that as IGAD Secretariat and as member state, we do support our health systems, infrastructure, and all that has implication on our health sector. I think the ambassador has given quite a number of inputs. I don't want to dwell on them. We've taken note, and we would ensure that we work with you. I would like at this juncture to recognize the German government through GIZ. If you have any input, we want to hear from you. Before I hand over the mic to His Excellency Dr. Warkane to invite our chief guest. GIZ, you want to? Thank you. 3 minutes, then we are.
Thank you very much, ladies and gentlemen, excellencies, directors, distinguished guests. Thank you for having us here. GIZ, as the technical organization which works on behalf of the German government, sorry for correcting that, I like to stress that we are not government, we are the general contractor to the government on technical issues. In that function, we are extremely pleased to be here and looking also into the issues of cross-border health and surveillance issues, which is the reason why we are sitting here together. GIZ has a very long history with Igad for, I don't know, 20, 25 years. And we are looking forward to continuing to work with the Secretariat, with Igad, and in particular with the member states, because the member states is, from our point of view, as the Executive Secretary already pointed out, this is where the things are happening on the ground in order to improve the situation in the cross-border areas which are remote and as such, more or less disadvantaged. So again, thank you very much for having us here, and thanking also the Secretariat in the field of COVID-19 response for this excellent cooperation which led to the introduction of the data protection policy here. We stand ready to assist in the implementation of this activity. Thank you very much indeed.
Thank you, Gunther Meyer, for those remarks. We continue to work with the GIZ and our development partners in ensuring that we implement the regional data protection and data sharing policy for our region. His Excellency has talked about the maternal, infant, young child and nutrition strategy, the knowledge for health. We have a lot of intervention, the Igad Journey Card. We have quite a number of interventions under this program on health and digital health, and we count on our member state support, our development partners, to ensure that we do implement the recommendations that come from this. With that, I want to take this opportunity to request my boss, Excellency Dr. Warkane, to invite Senator Kagwe to officially open the meeting for us. Thank you. Over to you, Excellency.
Thank you very much, Dr. Fatuma, for a very able master of ceremony. I thought that you are only health professional, but also you can manage very well this kind of meeting. Thank you very much. And also I want to take this opportunity to thank the previous speakers, especially Ambassador Aidan O'Hara from European Union and Mr. Gunther from GIZ, who are very important partners in our journey of challenge that we faced, especially in the last 2 years, and we hope that we'll continue this very important relationship. So I know later on we can get a lot of inputs from other ministers who are here and joining us virtually. But now it is a great honor and pleasure to invite His Excellency Senator Mutahi Kagwe. He is Cabinet Secretary of Health, Republic of Kenya, our host, and also, as I've mentioned, a very good friend of Igad. Your Excellency, the floor is yours.
Thank you. Thank you very much indeed, and good morning, colleagues. Your Excellency, can you hear me clearly? Your Excellency, Dr. Wokne Gabayehu, my brother, the Igad Executive Secretary, the Honorable Abdile Ahmed Lobla, the Minister of Health, the Republic of Djibouti, the Honorable Kanifa Kayuo Bagirama, Minister for State Health, General Duties, Republic of Uganda, Mr. Aiden Ohal, European Union Ambassador and other ambassadors present, Ambassador Magdi Ahmed Mofadol Enur, representative of the Minister of Health, Republic of Sudan, Dr. Abdinasi Mukhtar Ibrahim, Director General of the Federal Ministry of Health, Somalia, representing the Minister for Health, the Honorable Victoria Anip Maju Ashut, representing Ministry of Health, Republic of South Sudan, Dr. Ruth Negatu, Director General of Health, representing the State Minister of Health in the Federal Republic of Ethiopia, and I know that my sister Leah Tendese is listening to us as well, and I greet you, Waziri, members of the Igad Secretariat, members of the Fourth Estate, distinguished guests. Ladies and gentlemen, first, let me express our pleasure as Kenya to host this 13th Igad Annual Health Ministers meeting, and for me, a great honor to be serving at this point in time and to welcome you to our beloved country. We are just all stabilizing, or seemingly stabilizing, from the effects of COVID-19, and therefore do not take it for granted that the Council decided to do our first physical meeting here in Kenya. I wish to thank Igad members for coming to Kenya for the Health Ministerial meeting this year again. As some of you might be aware, we successfully hosted the 9th Igad Ministerial meeting on surveillance and outbreaks in Nairobi in July of 2016, and previous meetings in 2007 and 2010, also in Nairobi. This time, we are especially excited that the chosen venue of the 13th meeting is Mombasa, the second largest city in Kenya, a top-rated tourism destination for its famous beaches and historical sites. And I really do hope that you take some time out to sample some of what this city has to offer in entertainment and sightseeing. At a time when the World Health System has been stretched to the limit, I would like to start by acknowledging Igad's work in addressing health concerns on cross-border population and refugees over the last decade, and especially during the COVID-19 pandemic. Indeed, the Igad region and Africa as a whole cannot achieve universal health coverage if we leave any single person behind, especially the marginalized and vulnerable persons. This includes cross-border, mobile, pastoralist communities that can easily be forgotten. Like the famous Ratan-Tata quote goes, and I quote, "If you want to walk fast, walk alone, but if you want to walk far, walk together," and I end quote. I'm sure we want to walk far, so we must all walk together. I would like to appreciate Igad's support to Kenya over the years, particularly establishment of the proposed International Center of Excellence for Nutrition in Kenya and an accompanying network of satellite centers in member states. This hub and spoke model, once realized, will be a game changer in nutrition training for the entire region, and will offer great opportunities for collaboration between member states and external partners. As the Ministry of Health, we commit to continue offering the necessary support to ensure that this Center of Excellence is realized for the benefit of us all. I also wish to acknowledge Igad's great contribution in supporting the Kenya government's effort in combating the COVID-19 pandemic by providing PPEs, supporting the setting up of quarantine centers, and the isolation facility at Kenyatta University Teaching and Referral Hospital, donations of ambulances for the ASO counties of Wajir, Mandera, and Turkana, mobile laboratory equipment, and other activities to strengthen cross-border and regional surveillance. And my brother, we thank you for this great effort, and I received those contributions from you. Thank you. All these initiatives amidst the COVID-19 pandemic are indeed commendable, and as a country, we are also grateful for them. We know, just like the case of a nation, the effects of the pandemic have meant that the regional body has had to adopt and change. Given the lessons learned from this pandemic, I would like to take this opportunity to highlight what I see as the evolving role of the Regional Development Organization, such as Igad, and indeed other continental organizations. Fellow ministers, Your Excellencies, the need for countries to work together has been sharply thrust upon us. We now know, perhaps better than any time in the past, that the countries are more connected than ever before. A health challenge in one country can very easily manifest in another, and therefore we cannot work in isolation. We need to break the silo mentality and embrace cooperation across countries in the region. And perhaps no other sector requires this cooperation as much as ours, the health sector. We need to stimulate conversations across the region and leverage on the respective comparative advantages in each country to achieve greater efficiencies, to better coordinate our response to future epidemics, as well as other health emergencies and threats. We know that vectors and other carriers of disease do not respect boundaries. And in the same way, we should pull together, regardless of our geographical boundaries, to attack our health challenges as a single, united army. First, as we build back better, we need to equip our regional institutions, such as the Regional Collaborating Center for the Africa CDC, the recently launched messenger RNA technology transfer hubs, regional efforts to promote local and regional manufacture of medicines, vaccines, among other regional initiatives, with the necessary capacities to address the future health needs of the continent. Secondly, we need to embrace sharing of information, and this has been mentioned by previous speakers, but I want to reiterate that the sharing of information and data across borders to contribute to improved health outcomes and strengthen disease surveillance. In this regard, I laud Igad's work on health digitization and urge all member states to endorse the policy documents in front of us today, including regional cross-border data sharing framework, the data sharing implementation strategy, as well as the digitization roadmap. After this meeting, and once we endorse the documents, I also urge that we support their implementation by using technology, moving away from paper-based systems, and leveraging on fiber optic internet that is now widely available in our region to enhance efficiency and speed of data sharing between member states. The third issue in breaking the silo mentality is in regards to health workforce. We need to think about developing the human resource for health to keep up with the other advancements in the health systems. We need to reposition our health workforce for the future, not only to address the challenges affecting the continent's health sector, but also to reform the workforce for the global market by enhancing their global competitiveness. Just last month in February, Kenya hosted a major international conference on harmonization of the curriculum and training of health professionals in this very hotel. The conference was attended by more than 1,000 delegates from 27 countries across the region, representing health and education stakeholders, including academic scholars, researchers, public health experts, medical specialists, and trainers. It ended with a call to policymakers, such as ourselves, to reform, recalibrate, and harmonize the training and curriculum of health professionals to respond to technological advancements and changing health needs. No other input, no other variable is as important as the training of health personnel and health capital and health personnel capital in our region. Everything else works because we have got trained experts in the area of health. And now that we are gathered here as GAD Health Ministers and technocrats, I dare say that we need to challenge ourselves to think not just how our health workforce responds to our domestic needs, but rather how they can respond to our collective regional needs. Interestingly, we might find that in responding to the regional needs, we shall respond to our domestic needs even better. Fellow ministers, Your Excellencies, as I conclude, I take note that COVID-19 was a wake-up call for all of us. We need to hold and think outside the box about how to develop Africa solutions for Africa problems in health going forward. This might be a cliche, but it aptly captures our greatest lesson from the pandemic. We know that the disruption of global supply chain led to the isolation of many countries, especially those in the global south. We know that commodities were delayed in getting to our countries, and we know that we needed each other more to fill the gaps that were becoming apparent the more the pandemic continued to bite. We know that we suffered because of lack of vaccines. We know that we suffered because of lack of PPEs. We noticed that it became a situation of every man for himself and God for us all. And if we didn't learn about self-sufficiency in this pandemic, we are very unlikely to do so in the future. It is my belief that we did learn something. And self-sufficiency is a subject that must stay on our tables continuously and sustainably. We need to develop and support the implementation of policies that promote local and regional innovations, sustainable solutions, partnerships, and collaborations for the future. I call upon all the partners, development banks, and other multilateral partners to support regional and local initiatives to improve health systems in Igad and in Africa. I thank you very much. God bless you all. Asanteni sana, and it is now my pleasure to declare the meeting officially open.
Thank you very much, Your Excellency, for this very comprehensive speech. Especially, I'm very happy that you mentioned about health digitalization. That is a very important instrument that we in Igad feel that the best way to integrate our region, the best instrument to integrate our region is through digitalization, and health is the softest vehicle to bring us to our aspiration of regional integration. So I'm very happy for the points that you have mentioned, and also earlier, Ambassador Majid, our chair, also mentioned the challenges that we were facing. So thank you, Your Excellency, for this comprehensive speech. Let me now give you the floor back to you, Your Excellency, to take us, to lead us to the next sessions. it is intervention from the ministers, our members here, so you are a very appropriate person to take us to the next session. Thank you, Excellency.
Thank you. Now, ladies and gentlemen, it is a time for us to hear the statements from our member states. And I would like to begin with a statement from Djibouti. Djibouti, you have the floor.
Monsieur le Président de la séance,
Mr. Chair of the meeting,
le
Excellency,
secrétaire du cabinet
the Cabinet Secretary
de la Santé du
of the
Kenya.
Ministry of Health in Kenya.
Merci de m'avoir donné la
Thank you
parole.
for having
Excellence,
given me the floor.
Mesdames et Messieurs les ministres de la Santé du pays
Excellency,
d'Igad,
ladies and gentlemen from the Ministry of
Excellence,
Health of
Monsieur le
Igad,
secrétaire exécutif de
Your
l'Igad,
Excellency, the Executive Secretary of
Excellence,
Igad,
Monsieur le premier secrétaire du cabinet du ministre de la Santé,
the Cabinet
Kenya,
Secretary of the Ministry of Health in
Excellence,
Kenya,
les ambassadeurs
Your
de pays de l'Igad,
Excellencies, ambassadors of the Igad member
Madame la
states,
directrice de la division de la
the
santé
Director of the
et le
Health
développement social de
and
l'Igad,
Social Development
Mesdames et Messieurs
in
les
Igad,
représentants des organismes
ladies and
internationaux,
gentlemen,
les partenaires de
representatives
l'Igad,
of international
Mesdames et
organizations,
Messieurs les
partners of
directeurs et
Igad,
représentants des pays
ladies and
membres,
gentlemen, representatives of
honorables
member
invités,
countries,
chers
distinguished
participants,
guests, dear
bonjour,
participants,
salam alaikum
good
wa
morning,
rahmatullahi wa
salam alaikum.
C'est un honneur pour moi
It is an honor
d'être
for
présent
me
parmi
to
vous pour
be
cette
with you
13e
here for the
rencontre ministérielle
13th
ayant un focus
ministerial
sur les
meeting,
réfugiés et
which
les
is
populations
focusing
mobiles dans
on
les zones
populations and
de nos
mobile
populations du
cross-border
pays d'Igad.
populations in Igad member
Dans cette
countries.
région,
In this region,
régulièrement confrontée à des
which
flux
is
importants
often
de populations de
confronted
réfugiés
by
et des
movements of
personnes
refugees
déplacées
and
et qui nécessitent
internally
une prise en
displaced
charge
persons,
sociale,
and which
médicale
need
et humanitaire en cette
social
période de
protection,
pandémie de la
medical
COVID-19.
services during
ces
this
conditions,
pandemic.
il est
In these
crucial
conditions,
et
it is
vital
crucial and
pour
vital
notre
for
organisation
our
qu'est l'Igad,
organization
à
as
travers les
Igad,
actions du secrétaire
through
exécutif,
the actions
de
of the
résoudre
executive
inlassablement
secretary,
ces défis
to
pour une meilleure
face
santé de nos
these
populations,
challenges
par
for
le
the better
biais d'un
health
dialogue
of
et
our
d'échanges
populations
régionaux constructifs
through
permettant
constructive
de nous
regional
mettre en
dialogue,
œuvre des
which will allow
solutions
us to
communes
implement common
et pérennes aux
solutions
pays membres de
and
l'Igad.
durable solutions for the IGAD
Excellences,
member
Mesdames et
countries.
Messieurs les ministres de la Santé,
Excellencies,
Excellences, le
ladies
secrétaire du
and
cabinet,
gentlemen,
Excellences, Monsieur le
Excellency
secrétaire
Minister,
exécutif, Mesdames et
Ministers,
Messieurs, je voudrais
Executive
d'emblée
Secretary, ladies and gentlemen, I
l'engagement
would like
de
to
mon pays
humbly confirm
à accompagner
the
toutes
engagement
les
of my
initiatives de
country
l'Igad
to
en faveur
support
d'une meilleure
all IGAD
collaboration entre les
initiatives
pays
to
et d'un
improve
partage
better
des
collaboration between
informations des données
countries
sanitaires.
and sharing
Si nous
of
voulons une
health data.
région forte,
If we would like to
nous
have a
devons nous
strong
donner les
region,
moyens.
we have
Nous
to
devons investir
provide the
sur nos
means, we
populations.
have to invest
Qu'il
in our
s'agisse de
populations,
populations mobiles,
be it mobile
réfugiés,
populations,
ou encore
refugees,
des communautés
or even
hautes.
host
Nous devons faire en
communities.
sorte
We have to
d'améliorer
work
ensemble
such
l'accès
that
à
we
des services de
all
santé de
work
qualité
together towards
dans
access to
une
quality
équité
health services,
avec le respect du genre
equitable
et à
services,
assurer la continuité des soins
respecting gender, and
au-delà
ensure
de nos
continuity
frontières nationales respectives.
of care
Pour ce
away
faire,
from our national
il nous faut
borders.
mettre en place
In
un
order to
cadre
do this,
commun
we need to put
d'action
in place a
et disposer d'une
common
réglementation
action
juridique
framework
assez forte
and have
et des protocoles
the legal
harmonisés
framework,
au niveau régional.
harmonized protocols
Il nous
at a
faut
regional level. We
un
need
système
to have
d'information sanitaire numérique
a digital
qui permettra
information
de
system that will
faciliter
allow us
les
to
prises de décision basées sur des
facilitate
données
decision
fiables
making
au sein des
based
membres
on
des pays membres.
reliable data
Pour
from
cela,
the member countries.
Djibouti a
In this
déjà entamé
regard,
par
Djibouti has
l'envoi
already
d'une requête
started
concernant la mise en place d'une
by
application
doing
SORMAS prônée
putting in
par les
place
GIZ
a
à travers
format
l'Igad.
application which is supported by GIZ.
J'ai le sentiment que cette application
I'm also confident that this application will help us not only in the border zones but also in public hospitals.
Car mon pays,
and this is something which is close to my heart because Djibouti,
au même titre que les autres populations flottantes, déplacées,
also receives lots of displaced populations.
La mise en place d'un système de santé digitalisé et les prémices qui va contribuer à contrôler les épidémies émergentes et rémergentes et en limiter l'impact sur les populations déjà fragilisées par des sécheresses
of these populations which are affected by famine, drought and other health conditions and recurrent displacements. Your Excellencies, Ministers, Executive Secretary, ladies and gentlemen, I would like to
qui, à mes yeux, me semble important.
Talk about a theme which is very important to me. This about the issue of the nutritional status of these vulnerable populations, be they cross-border populations, and especially children within these populations. This is a theme which is close to my heart.
Ma vie antérieure de médecin pédiatre.
Because I was a pediatric, and I believe that if we invest in the nutritional health of these children, is to ensure a better future for them as adults and responsible citizens. And this is important for the future of our region. I commit to support the reduction in the mortality and morbidity rates among children. I would also like to talk about COVID vaccination in this region. We need to strengthen vaccinations within the common borders and put in place a harmonized strategy in order to achieve higher vaccination rates in our region. We need to relook into our communication strategies, creating awareness, behavior change in order to achieve higher vaccination rates in border zones. Djibouti, since the last 6 months, has started vaccinating refugees, floating populations in its territories, and would like to invite all people who desire to be vaccinated to come get vaccinated. I would like to conclude by congratulating the team of the Igad's executive secretary, led by Dr. Wakene and all our donors, EU, African Development Bank and USAID. I would also like to thank you, Mr. Executive Secretary. I'd like to thank the Director of Health and Social Development for the results she has been able to achieve. I will not forget our technical partners, and I would like to congratulate GIZ, who have been with us for a very long time. I would also like to thank CDC Africa for their contribution during this pandemic of COVID. I would also like to thank all the heads of divisions in the health division and all member countries who have participated in all the work and the reflections during the last 2 days. Finally, I would like to express my gratitude to the ministries of health in our brother country, Kenya, which has hosted us in this beautiful country for this high-level ministerial meeting for the for IGAD member countries. Africa needs to progress, and IGAD member countries have to be a good example of effective collaboration to improve the life conditions and the health status of its populations. I am convinced that we are capable of achieving the objectives that we have fixed for ourselves. Thank you very much. Assalamu alaikum.
Thank you very much, Minister. I would now like to invite Ethiopia to make their statement. Ethiopia, you have the floor.
Thank you. Before going to my formal statement, I would like to express Her Excellency was with us online, but is boarding to travel to a place in country. So I will be making the statement on her behalf. Igad Executive Secretary, Your Excellency Dr. Workana Gabayo, Your Excellency Senator Mutahi Kwage, Cabinet Secretary, Ministry of Health for the Republic of Kenya, Honorable Ministers, delegates from member states, and distinguished guests. The government of Ethiopia appreciates the call to member states for the 13th Igad Health Ministerial Committee meeting on refugee and cross-border health initiatives. The country does strongly believe that it's mandatory to advance the regional health agenda to national, subnational, while not leaving behind the need of refugee, returnee, host communities, and cross-border population. We all can agree that the cross-border mobility of populations face major barriers to access to the basic healthcare services due to the complex socio-political dynamic of the public health system in the context of migration and cross-border mobility. While it's easy to clinicians and public health workers to provide healthcare needs to a static population, the health outcome for cross-border population is often difficult to monitor and implement. Ethiopia has tried to take collective responsibility that every refugee, returnee, other cross-border population and members of the communities have access to quality healthcare services within our countries without discrimination, with the alignment of implementing major health programs and interventions in the health system. Amongst them are COVID-19 response, TB, HIV, and malaria, RMNCH, nutrition and prevention of cancer and disease surveillance, and response with all partners. I would like to express my heartfelt appreciation to the Igad Secretariat for their assistance during the COVID-19 response efforts, which include the provision of PCR machines, extraction and test kits, standard and advanced ambulances, and protective equipments. We would like to request that Igad Secretariat continue its usual support and coordination in order to translate this refugee, returnee, host community, and cross-border health initiatives into the Igad region. In doing so, we are examined and adopted the priority interventions and actions proposed in the Secretariat's declaration by Igad member states, Kenya, on 25th March 2022, and express our commitment to the implementation. I thank you.
Thank you very much. Thank you very much indeed. I would now like to invite Kenya to make his brief statement as well.
Kenya is chairing today. Allow me then, on behalf of the Honorable Minister for Health, Republic of Kenya, to make his remarks on his behalf. Distinguished Executive Secretary of the Igad, Honorable Workana Gabayo, distinguished ministers, distinguished ambassadors, distinguished delegates and guests, ladies and gentlemen, I am delighted to be here to present our country statement. We acknowledge health as a fundamental human right, and this has been recognized in our supreme law, the Constitution of Kenya. We recognize that achieving the right to health implies providing timely, accessible, affordable, and high-quality healthcare services to all. The government has an obligation to progressively realize the highest attainable standard of health to the population. To this end, Kenya has embarked on scaling up of universal health coverage and recently launched the Universal Health Coverage Policy, which was launched by His Excellency the President of the Republic of Kenya. We are aware that in providing the right to health, we must prioritize the needs of those who are most likely to be left behind in the provision of healthcare services, including the marginalized and the vulnerable in the societies. Kenya deeply appreciates IGAD's role in complementing government efforts to implement health programs among refugees, cross-border mobile populations, and other displaced populations. Additionally, Kenya commends the IGAD Secretariat and the member states for dedicating today's ministerial meeting to discuss issues targeting these critical groups. Acknowledging the health and socioeconomic disruptions caused by the COVID-19 pandemic and the need to build strong and resilient health systems for attainment of universal health coverage, Kenya will continue to support efforts towards prevention, preparedness, response and recovery to COVID-19 and other epidemic-prone diseases, and urges that other IGAD member states do the same. Kenya supports the adoption of the strategic documents to implement key recommendations on the IGAD health digitization, health for refugees, cross-border health, and the plan of actions for the Nairobi Declaration from this ministers' meeting of upscaling and improving health services for refugees, detainees, and host communities. Kenya continues to call for improved leadership, coordination, and planning of refugee health services, proposals for strategies to improve long-term and sustainable financing of these services, as well as improved human resources for health and access to quality medical products in refugee health facilities. I look forward to continued engagement and strengthened regional collaboration in improving health services for refugees, detainees, and host communities in the IGAD region. I thank you.
Thank you very much. I now wish to invite Somalia to make their statement. Somalia, you have the floor.
IGAD Secretariat, Chairperson, Minister, Excellence, colleague, ladies and gentlemen, all protocol observed. Assalamu alaikum wa rahmatullah. Excellence, ladies and gentlemen, my name is Dr. Abdul Nasir Mukhtar. I'm the Director General Minister of Federal Minister of Health, Somalia. Ladies and gentlemen, it's a great honor for me to join you today for the 13th Igad Health Ministerial meeting. And I thank you for the government of Kenya for hosting us in this beautiful city, Mombasa. Excellence, ladies and gentlemen, firstly, please accept a warm greeting from our Minister, Her Excellency Dr. Fawzia Abika, who could not join us today for this great event due to the other unaffordable circumstances. Excellence, ladies and gentlemen, COVID-19 pandemic has shown us the urgent need for close collaboration in the health sector at a regional and continental level. It has also shown us how vulnerable the population of IGAD member countries are during the disease outbreak, which also overstretched and thus further weakened our healthcare system. While rebuilding our healthcare system and strengthening the national response capacity of public health security in our respective member countries, we recognize the importance of paying due attention to the health of the most vulnerable population of our country, such as the refugees, returnees, and the host community, and cross-border population. Therefore, our collective effort to address the health of this group is important for us. To strengthen our collective effort toward the agenda of health for refugee, returnee, and cross-border population, I wanted to emphasize the key important action agreed, which include the strengthening the coordination of key stakeholders within the countries and among the IGAD member countries, paying attention to these vulnerable groups, harmonization of our healthcare system and regulatory systems, with a focus on medicine regulatory harmonization system, and include other regulatory capacity, including health professionals. Integrating this commitment to the national health priorities and system strengthening and digitalization of the health information system of all member countries, and enhancing knowledge management and learning and data sharing among member countries. Mobilize additional resources to support member countries in an equitable manner to respond to the public health emergency, particularly to COVID-19 response, including improving COVID-19 vaccination coverage. Strengthen our collective effort toward improving the equity, coverage, and utilization of the essential health care service to address the health care and nutrition need of the essential health care service, to address the health care and nutrition needs for maternal, infant, and child health. Also, sustain our effort toward controlling the communicable disease such as the malaria and elimination initiatives. Excellency, ladies and gentlemen, on behalf of the Minister of Health and Human Services of the Federal Government of Somalia, we are committing to politically and technically support and participate our collective effort and initiative to address the common regional issue with special attention to refugee, returnee, host community, and cross-border population. Finally, I take this opportunity to thank IGAD Secretariat for their continuous effort of mobilizing resources to complement and address critical gaps of healthcare need for the vulnerable population in the member countries, and for their facilitation in developing and implementing regional policy and strategy in which we member countries also committed to implement our countries. Once again, thank you all. May God bless you. Thank you.
Thank you. Thank you. Thank you very much. Thank you very much indeed. I now wish to invite South Sudan to also make their statement. South Sudan, you have the floor.
Senator Mutehi Kagwa, Minister of Health, Cabinet Secretary, Ministry of Health for Republic of Kenya, IGAD Chair, EU Ambassador, IGAD Executive Secretary, His Excellency Wakne Gabriaho, Director, Health and Social Development Division, Honorable Ministers, Director Generals, Directors, experts, members of the press, ladies and gentlemen, it's a great pleasure to address you on this remarkable occasion as we adopt these important documents. I do commend and applaud the great work done by the IGAD Secretariat, Member States, health experts, technical working groups, steering committee. Thank you so much for employing your proficiencies to produce these documents with sound recommendations. I will not miss the opportunity to thank our donors and partners who supported this important initiative. COVID-19 pandemic has presented an opportunity to avail resources to us to work together to provide health services to the cross-border mobile populations, refugees and IDPs who tend to be more neglected and vulnerable to diseases. Working in silos has caused our region, and more especially the mobile populations across our borders, to encounter substantial burden of disease. We hence commend and support digitalization, integration, and putting in place strong coordination mechanisms. South Sudan register heartfelt appreciation to IGAD Secretariat for having consistently communicating with us, which resulted in our full participation in IGAD activities, and more especially in the development of these important documents. Congratulations for the job well done. Furthermore, South Sudan acknowledges IGAD support for COVID-19 response in the region, and in South Sudan in particular. We have received ambulances protective equipments, test kits, and infrastructural support yet to be accomplished in rank and nimble. Honorable Chair, as a way forward to have a better region, there is great need to have accurate and early detection of diseases or outbreak across borders through strengthening of surveillance system and data sharing among the member states. It is our hope that IGAD Regional Health data sharing and protection policy will meet this need. We also endorse and recommend adoption of all documents presented here, and my country will ensure playing our part to fully implement them to bring improvement in healthcare services and change for better the lives of refugees, IDPs, mobile population across the borders. Honorable Chair, South Sudan still calls upon IGAD and other development partners to continue providing technical assistance and capacity building in identified areas. And finally, I would like to thank the Government of the Republic of Kenya for hosting the 13th IGAD Health Ministerial Committee meeting on Refugee and Cross-Border Health Initiative and providing conducive environment for all processes that were undertaken. We have enjoyed the beautiful sceneries of this great nation, and I thank you all.
Thank you very much indeed, my sister. Now we will hear the statement from Sudan.
Bismillah ar-Rahman ar-Rahim. Honorable Minister, Senator Kagwe, Cabinet Secretary of Health of the Sisterly Republic of Kenya, Honorable Ministers, Your Excellency Dr. Warkana Gabriyahu, Executive Secretary of Igad, Ambassadors, experts, heads of divisions and departments at Igad Secretariat, heads of mission of Igad Secretariat at the different Igad member states, ladies and gentlemen, all protocol observed. Now, wearing my other hat and at the national capacity as a representative of the Republic of the Sudan, I would like to start by thanking again our host, the government and the people of the Republic of Kenya, for hosting us and also for facilitating this very important meeting and for the hospitality accorded to all delegations and also to the delegation of the Republic of the Sudan since our arrival here in this beautiful city of Mombasa. I would like also to thank our sisters and brothers at the GAD Secretariat for their efforts, which culminated in the preparation for this very important meeting. I would like to thank all the members of the technical teams, experts, members of the steering committees for their very hard work and for preparing the draft declaration that is going to be signed in the next couple of hours. I would like also to thank our development partners for their support, which enabled us to hold this meeting. I would like to say that Sudan is ready to strengthen cooperation with IGAD Secretariat and with our sisters and brothers in IGAD member states, and also with our partners from Africa and overseas in addressing all relevant issues related to health of refugees and cross-border communities, as well as on health security. We are determined to continue cooperating on all these very important aspects and very important fields for our region and for the future of our region. We will do our best to implement the documents and strategies that have been signed, and we are ready to cooperate with all of you. Secondly, I would like to call our regional and international partners to upscale their support to Sudan in the health sector, taking into account many factors. One of them to take into account the severe impact of the political instability on our fragile health system. Secondly, also to take into account the fact that Sudan is the country which hosts the largest number of refugees in Igad region. Also, we have a national very important and very ambitious health program called Essential Health Benefit Package, which address all the issues related to health, starting from nutrition, primary health care, and to all other aspects of health. This very ambitious program covers all sectors of the society, whether they are refugees, IDPs, returnees, or host communities, or citizens. We renew our call for our partners to support this very ambitious program, which is going to be very helpful and very essential in improving the health cooperation and also improving the health condition for immigrants, refugees, and cross-border communities. Lastly, but not least, I would like to say that Sudan government is ready to strengthen cooperation with Igad Secretariat and with our development partners from the region and overseas to speedily establish the Igad Regional Health Emergency Preparedness Center, which is going to be one of the lessons that we have learned from COVID-19 pandemic, that we have to be ready for future pandemic. COVID-19 was not the first pandemic that hit the region or the world, and it is not going to be last. So in order to strengthen our response to future emergencies, health emergencies, we have to establish this center, Regional Emergency Health Preparedness Center. We will do our best, and I would like also to again thank our host, the government and the Republic of Kenya, and wish all of you very fruitful deliberations and safe journey back home. Thank you.
Thank you. Thank you. Thank you very much indeed, Sudan. We now will hear the statement from Uganda. Uganda, you have the floor.
Your Excellency, Senator Mutahi Kagwe, Cabinet Secretary, Minister of Health, Government of the Republic of Kenya, Your Excellency, the Executive Secretary, Igad, Your Excellencies, my colleagues, the Honorable Ministers of Health of the Member States, distinguished experts of Igad Member States, Your Excellencies from European Union delegation and UN bodies present here, our health and development partners, distinguished participants in your capacities, media fraternity, ladies and gentlemen, protocol observed. Your Excellency, allow me to introduce myself as I came in, as you had started. I am Honorable Anifa Kawoya Bangirana, the Minister of State Health, General Duties in the Government of Uganda. Your Excellency, I bring warm greetings from my President, His Excellency Kaguta Museveni, the President of the Republic of Uganda, and I bring warm greetings from my Senior Minister, Dr. Jane Acheng, who wishes us well during this session. Your Excellency, I thank you for this opportunity to participate in the Igad Health Ministerial meeting for the year 2022 to present my country's statement. On behalf of the government of the Republic of Uganda, I wish to convey our gratitude to His Excellency, the Executive Secretary of Igad and the Member States for the great partnership, cooperation, and support especially during the COVID-19 pandemic. In a special way, I wish to thank the government of Kenya for the warm welcome and cordial relationship in this cross-border health governance, especially during the pandemic of COVID-19. The technical reports I received from the Ugandan delegation on this meeting is in line with our government's commitment, aspirations of enhancing Pan-Africanism and regional cooperation. Successful health systems across the world from Africa, Asia, Europe, and Americas benefit from a meaningful collaboration and partnership between regional and bilateral groupings. Your Excellency, therefore, I'm joining you here today. My joining you here today allows the Republic of Uganda to support the declarations and identify pathways to strengthen and harmonize our contribution to Igad. The government of the Republic of Uganda has been working closely with Igad and member states in responding to the health needs of our citizens and supporting programs to enhance continuity of health care services during pandemics. Igad has supported Uganda in the following areas: COVID-19 response, cross-border health programs, primary health care services, delivery, HIV/AIDS program, TB leprosy program, medical supplies, name them. And as a country, Uganda, we are very grateful to Igad. Thank you so much. In addition to Igad's response to the COVID-19 pandemic, the Ugandan government has had a long-time collaboration on region strategy for implementation of health programs, especially along the border points of entry. This is in tandem with the African Union framework on ending some disease burdens by 2030. Your Excellency, its importance of health information, digitalization, cross-border data sharing on health, cross-border disease surveillance, health for refugees, cross-border health protocols, and regional knowledge management has been clearly articulated by the Igad Director of Health and Social Services. I don't need to add more. I thank you for the declarations. You must have heard from the Ugandan delegation how well Uganda is doing in putting necessary pieces in place to improve health services delivery in the country and the region. Through more efforts and more is needed. Indeed, Your Excellency, I need to say Uganda is leading in this region to be one of the recipients of the refugees. And we are proud. We join hands with Igad to ensure that we care for humanity. The journey to universal health coverage is on course, and additional steps are being taken to enhance the speed. We truly believe that with the support of Igad, we can achieve this and more. The government of the Republic of Uganda is exploring how we can work within existing structures, resources, and mechanisms to help achieve our goals and other priorities as highlighted in the final declaration, which I've had to go through. In conclusion, Your Excellency, the government of the Republic of Uganda recommends to Igad Secretariat and Igad member states to strengthen the Igad health regional partnerships and cooperation, strengthen health systems in the region. Key recommendations also include strengthening cross-border health teams and regional health systems integration. In summary, my country is committed to working with Igad and other health partners through a multi-sector approach. We look forward to contributing to the declaration action points, and we will continue to pursue partnership with Igad, which we see as a crucial game changer in Uganda and Igad member states. Please accept my assurances of the highest consideration that we are in this partnership together, and we do commit ourselves to the declaration for God and my country. Thank you.
Thank you very much. Thank you very much. Uganda, having heard from the member states, distinguished participants, I would like to invite two partners with us. One is EcoCare and Africa CDC. So I would like to give this opportunity for EcoCare to just say one or two things, and then perhaps have Africa CDC also say something. EcoCare?
Your Excellencies, Mr. Executive Secretary, Honorable Cabinet Secretary, it's a great pleasure for EcoCare Ecologue International to be present today at the Igad meeting. We had yesterday a very wonderful exchange with the Member States experts and Igad Secretariat on the services we want to provide, and working with Igad to ensure that we help Igad in addressing the COVID-19, the pandemic challenges in the region, but also strengthening healthcare system and resilience for the future challenges that we might face in the future to come. Very briefly, I want to say that we are here to serve as a tool to Igad and to the Member States to help and to support, to provide our solutions in addressing the challenges you face. We are here to see how we can work together to ensure that we target the most vulnerable groups that are in the region and ensure that they have access to healthcare and access to the solutions we can provide together with Igad and the Member States. I would like very much to say that we as a company are very happy to be here. It's the first time, and we look forward to work with you to see how we can together address the issues addressed today here and see what we can do to provide support and facilities to the vulnerable groups. Thank you so much.
Thank you. Thank you very much indeed, and thank you for the support that you continue to give Igad. CDC, you have the floor.
Thank you very much, Chair, and good morning, colleagues. To the Honorable Cabinet Secretary of the Ministry of Health in Kenya, to the Chair of Igad, represented here by Ambassador Maged, and to all the ministers who are physically here and those who are joining us virtually, distinguished representatives of government, donors, private sector, all protocols observed. As Africa CDC, we are very delighted to join this 13th Igad Health Ministerial meeting that has, over the last few days, deliberated on the critical health programs in the region, particularly tied to the movement of people. We are meeting, though, today in the backdrop of the COVID-19 pandemic, and we remain acutely aware of the disruption and havoc that disease threats generally pose to Africa and indeed the world as a whole. The African Union Assembly has expressed clear political commitment to tackle the continent's health challenges. Indeed, in line with the vision outlined in Agenda 2063, our heads of states and government established the Africa CDC back in 2017 with the express mandate to safeguard our continent's health. As a result, the Africa CDC was given a mandate that provided it with a unique position to coordinate actors working in the public health space to address the multitude of public health challenges that are affecting our continent. It is, in our view, one of the smartest investments that the continent has made in the recent past. In the few years of its existence, Africa CDC has supported our member states on the continent across diverse public health needs, led continental response efforts against Ebola, COVID-19 pandemic, and many other disease threats and outbreaks, led public health dialogue, and instituted strong partnerships with multiple actors and stakeholders across the continent. As a critical stakeholder and the African Union's building block, working closely with the regional economic communities like Igad is one of the highest priorities of Africa CDC and the African Union. And this is very clearly stipulated in our statute. We strongly value our partnership and aim to continue our collaboration to align our efforts, create synergy, and stay focused on the shared vision of Agenda 2063. This year marks the 5th anniversary of Africa CDC as a continental public health agency. And as we mark this milestone, we advocate for partnerships to be guided by trust, shared commitment, transparency, and efficient use of resources. Let us all work together to implement Africa's new public health order, which has been championed by the Africa Union from its political leadership to its secretariat and down to Africa CDC. I call upon all stakeholders to continue with their efforts in strengthening and supporting our capabilities to ensure that effective and efficient public health emergency preparedness and response is achieved on the continent. I also call upon all of us to ensure that this is done in synergy to the benefit of Africa. As Minister Kagwe has very correctly put it today, if we want to go far, then we must go together. Honorable Ministers, ladies and gentlemen, allow me to echo the Africa Union Assembly decision, which calls upon all member states to expedite COVID-19 vaccination and aim for the 70% target that we have set for ourselves here on the continent. Also, to actively participate in Africa CDC's efforts to support local manufacturing of all health products, not just vaccines, but all health products that we need in the health sector. Your support to the various initiatives that we have established is not only valuable for the continent, but will also directly respond to these decisions that the Africa Union Assembly have already made. I applaud Igad for its commitment to improving health security in the region and for coordinating its health security work with Africa CDC and the Africa Union. I must also applaud the government of Kenya for hosting the Africa CDC's regional office in Nairobi, and we are looking forward to continuing this collaboration. And Honorable Minister, we are looking to the time when we can be able to break ground in building a proper structure for the Africa CDC's regional office in Kenya. Honorable Ministers, ladies and gentlemen, we are only as strong as the bond that is between us, and we can only be as successful as the direction that we decide to take. Africa remains ours, all of us, and it is only us who can be able to make success of the health security agenda. So let us continue to work together in close coordination to the benefit of the citizens of this continent. I thank you.
Thank you very much indeed, CDC, and I can commit to you that the ball is in your court when you want to break ground. The land is there, the will is there, and when you want to break ground, please let us know. I would now like to go back to Dr. Fatuma so that you can show us the declaration.
Thank you, Excellency. Thank you, speakers, distinguished colleagues. This brings us to the next and the second last session of our program. We would request the media to project the English version of the declaration. We would request through the chair that if there is any member state that has issues, they can give us their input. A bit of a protocol breach. I am told I removed the flags when the meeting is still on. Apology for that. We would have all our ministers here so that we have a ceremony of signing the document, which is led by the chair. So apology for that. I am not very political, so I sincerely apologize for that. Yeah. Thank you for your understanding. Colleagues, the Igad team, can we project the, 1 minute. In the meantime, we want to rearrange the high table, request Madam Fatia to join the rest of the House. The ministers, procedurally, I understand the Djibouti minister has to sit next to Honorable Senator Kagwe, the Uganda minister, then we can have the rest of the team sit on this side. If I'm making any protocol breach, I can also be equally advised. Excellent. Yes. I'm advised the minister, you can come. There, we'll hand over the process to Senator. Excellency, can you guide us on this? Yeah.
I would like to welcome my colleagues, ministers and representatives of ministers to the table so that we are able to sign the documents together. Please have a seat. Sudan, where is Uganda? Uganda, you are here. Very good. Yeah, I think it is very safe to take your own flag, just in case somebody else does, and then it becomes a political issue.
Yeah. Okay. Ethiopia. Dr. Ruth has to come, right?
Who do we have?
Dr. Ruth Nigatu of Ethiopia. Dr.
Ethiopia. Ethiopia, you are missing in action.
Just that. Dr. Ruth? Yes. Yeah, we need another chair. The media, give us 1 minute.
Are we all here or do we need another chair?
Yeah.
If we could be assisted with another chair. Secretariat, we need one chair here for South Sudan.
Yeah, it's here, Excellency. We have an extra chair. South Sudan, Ethiopia, Sudan, Kenya, Djibouti, Uganda. I think we are full house. Excellency is also here. And I hand over the process to Senator Kagwe, Minister of Health, Kenya. Over.
Thank you. Thank you very much, Dr. Fatuma. We are now in the process of approving the declaration. The Igad, the 13th. If I could have your attention, ladies and gentlemen. If we could have your attention just for a few minutes. Could you please put up the declaration on the screens, please?
Can I ask the rest of us to take a seat so that we have some adequate space for projecting the declaration? The media, colleagues.
Okay. Distinguished colleagues, what we have on the screen is the declaration of the 13th Igad Health Ministerial Committee meeting on refugee and cross-border health initiatives. And that we, the preamble, is that we, the health ministers of Igad member states, convened in Mombasa, Kenya, on the 25th of March 2022, to discuss health initiatives for refugees, returnees, host communities, and cross-border population in the Igad region. Now, the document is fairly long, so I do not think it is necessary for me to read every word. It is on the screen, and therefore I am going to ask Dr. Fatuma that as we screen the first page, it will be the first page. I will ask for anybody with any comments on the first page, and then move on to the next page. So we have got page 1. Page 1. All agreeable with page 1? I hear no disagreements. Page 2. Page 2 is the one that starts with recording heads of state special summit. Pre-screen page 2. Any comments on page 2? I hear no comments on page 2. Page 3. That's the one that starts with mindful on the need. Page 3, I see no comment on page 3. Page 4, that we do here agree to the following. That is on page 4. If there is no disagreement on that, I move to page 5. This is a document, of course, our technical people have gone through very thoroughly, but nonetheless, it pays dividends to raise any issue that anybody might have on page 5. Page 6. Page 6. Yep, that's page 6. Page 7. Page 7. Right. And page 8. Page 8 is our signatures. So I think I can declare that we have all agreed with the declaration. Asanteni sana. Secretariat, if you could now organize the signing ceremony.
Thank you, Excellency. We have two versions, the English version of the declaration and the French version. Apparently, we have to sign, each and every minister has to sign those two copies, and you have them with you. So,
I see two.
for minister has not, doesn't have. I would know before we sign, if there are any corrections to be made, we would be happy to make it. Excellent, we will, this, okay.
Correction?
Yes.
On page?
The last page.
On page 8, or the Honorable Ruth Aseng. Ruth Aseng is not here, but you sign on behalf of Uganda? Or you?
Yeah, no, all pages must last.
Secretariat, do you want to make that correction of the person who, are we signing on the person who is here? Because even Ethiopia has got Tandese, who is also 4. Yeah, we assign 4. I think that's a better thing to do, because otherwise we would have to change the same document. I think the minister responsible is there, and I think the minister here can sign 4, the substantive minister in the country. If that is a carried idea, then we can proceed.
Okay. We can, yeah. If you can sign, yes, you can sign the last page of the both. We can sign, Excellency, 1 copy starts from this side, 2 copies, the French and the English, so that it moves from one minister. We have a photo, next you hand over. Yes. So, yeah. Yeah, it is here. Look on this page, Excellency. This one is the French, you have the English version. So we signed these 2 copies. You sign the 2, hand over to your colleagues. It is here. It is done. So we will, yeah, Doctor. Yeah. So we sign the 2 copies. Can we give a round of applause? The declaration now moving from the government of the Republic of Kenya to the government of the Republic of Djibouti. Thank you very much. A round of applause. The second signature. Thank you, Excellency, Minister of Health, Djibouti. We are proceeding to Uganda now. A round of applause, colleagues. Thank you, Minister, for signing and committing the government towards this declaration. Thank you. Now we are in Somalia. A round of applause on behalf of Her Excellency Dr. Fauzia Abikar. We do appreciate the government of Somalia. The French version is being signed by Somalia now. Thank you very much. This is a historic event in the Republic of Kenya. Media, I hope you are taking good photos of this ceremony. Thank you, Ambassador Magdi. Let's put our hands together for this. Thank you. Dr. Ruth Nigatu, on behalf of Dr. Lydia Tedessa, the Minister of Health, Ethiopia, we do appreciate the commitment of the government of the Republic, or the Federal Republic of Ethiopia. Thank you very much. A round of applause for Ethiopia, South Sudan. Thank you very much. We do understand our sister was recalled back, but because of her commitment, she decided to remain behind for this function. We do appreciate that commitment, and we hand over this to the chair. Thank you very much. Let's appreciate ourselves to the technical team. We say a big thank you. Asanteni, over to the chair and His Excellency.
I will now hand over the declarations to the Executive Secretary of Igad. Maybe we can all stand up for the photo.
Thank you very much. We, as Igad, are receiving the 13th Health Ministerial Meeting Declaration. A round of applause. Thank you, thank you, thank you.
Thank you very much. Thank you so much. Thank you. Asante. We are now heading towards the closing ceremony. Indeed, so I would like at this point to invite our Executive Secretary to just make a few remarks. I will then, before I make my final remarks, also ask a few remarks on behalf of the Chair, and then I make the closing remarks.
Thank you very much, Excellency. I don't have much to say, but I want to thank Your Excellency, Cabinet Secretary, Minister Abdullahi, all representatives, State Minister from Uganda, for your commitment and making this event to happen. This is very important day for us as a region. By signing this declaration, we agree that the health issue is not an issue of one country. It is a regional issue, continental issue, as well as international issue. There is no evidence than coronavirus that teaches us that we are living on the same house, and the challenges and opportunities are equally distributed in that house. So I can say, Your Excellencies, the health sector, health ministers are the leading ministers in Igad, member states who are steering together to fight different kind of health challenges that we are facing. I'm very thankful for our partners. I am very thankful for the chair, Sudan, and also, most importantly, we are very happy to be here in Mombasa, a very beautiful city, and to finally reach to this very historical declaration that will give us as a secretariat an energy to go forward. And finally, I want to take this opportunity to thank my team, which is headed by Madam Fatia, to do this. They did a lot of efforts that to reach to this day. Thank you, my team, and thank you, all of you. Asante.
Thank you very much. I would like to invite Ambassador on behalf of the chair to make some closing remarks.
Thank you very much, Honorable Minister. Also, I would like to start by thanking you personally for hosting us here at this beautiful city of Mombasa, and also for the hospitality accorded to all delegations since their arrival here, and also for agreeing to chair this important meeting. I would like also to thank the Secretariat of Igad for their efforts, which culminated with the signing of the declaration. I would like also to thank the technical teams that has relentlessly worked hard in order to prepare for this meeting until we arrive at our final destination of signing the declaration. Our thanks also to our development partners who has always been with us in Igad, whether in member countries or with the Igad Secretariat, supporting our different initiatives. I hope that we will strengthen cooperation in the near future in order to put a solid ground for our region. Also, I would like to say that now we have done the easiest part, that is signing the declaration. So now, and the other relevant documents, the next step is to start in implementing these documents and put them in implementing all these documents in good faith in order to strengthen cooperation on health security, data sharing, health management, and all these very important issues. Lastly, I would like to again thank each and every one of you for the support, for the hard work, and wish all of you a happy and safe journey back home, and hope to see you in the next in the next meetings in order to put this declaration into action. Thank you all, and God bless you all.
Thank you. Thank you very much, Ambassador. Fellow ministers, ambassadors, distinguished guests, members of the Fourth Estate, ladies and gentlemen. Let me once again express just how pleased Kenya is to have hosted this 13th Igad Health Ministers meeting that has discussed the health of refugees, cross-border, mobile, and other displaced populations. I would like to thank you all for the robust participation in today's meeting, and the technical teams for their hard work in putting together all the documentation that we have discussed today. Thank you very much indeed, the Igad Secretariat and the technical teams. Further, I would like to say a special thank you to the Igad Executive Director for convening this meeting and the excellent work that has gone into facilitating it. I would like, on our behalf, to acknowledge the strong commitment by governments, communities, and development partners. And on the development partners, let me just take an opportunity to mention the Global Fund, the European Union, USAID, AFDB, the Africa Development Bank, GIZ, especially on the health digitization that we are working on. We take special appreciation of that particular area, and the well-being of the people of Igad region, particularly the refugees, cross-border, mobile, and other displaced populations. Support to those communities, alongside other measures that ensure that all in our region are included in our health response, will accelerate achievements towards sustainable development goals on in the universal health coverage. Moving on, I would like to challenge all partners to support the programs that are replicable, and sustainable, and are transparently implemented. Those should be coupled with inclusivity at all levels to ensure ownership. Carrying our people along with us, we will further ensure that the programs respond to the needs of the communities. Relevance to our communities is an objective we must always strive towards. I'm excited that the framework we have adopted for today's declaration provides an innovative mechanism for continued engagement by member states through biannual stock-taking meetings, promotion of exchange, and sharing of best practices and success stories, policy briefings, and regional meetings. As I said in my opening remarks, the need for countries to work together is needed now more than ever before. Diseases do not need visas or passports to cross our borders. As countries, therefore, we cannot work in isolation. That is why we need to come together as IGAD member states to strengthen regional integration and overcome divisions so that we can come up with innovative and sustainable local and regional solutions to our most pressing challenges. The solution can only come from us as policymakers and technocrats. Before I close this meeting, I take this opportunity to thank you yet again, most sincerely, for making the time to join us here. Please do not be in a hurry to return to your countries, but instead take time to relax and enjoy your feet, walk to the beach. Integration begins with integrating in friendship. We need to get to know each other better as we walk around the beach. So in about 2 hours, we expect everybody to be in shorts and bikinis. It is now my pleasure to declare this 13th Igad Annual Health Ministers meeting officially closed. Asanteni sana, thank you very much.
Thank you, thank you, thank you. A round of applause again. Asanteni, asanteni, and now I speak Swahili. Asanteni as one of the AU language. Asanteni, asanteni, asanteni. Administrative information, Excellency, under your leadership, we would have a media brief. Yourself and your colleagues, led by His Excellency, the Minister. We have the COVID team just next to the near the ladies and gents. We would send a hard copy, or we would give you a hard copy of the declaration to each of the heads of delegation. However, we would also send you a soft copy of this document. I would want to invite you for a coffee. We also have our coffee break. I think everyone would be entitled for 2 cups of coffee, tea. Yeah, you've earned yourself that. With that, I want to take this opportunity to say thank you. And before we leave the room, let's give an opportunity for the high table to proceed for the media briefing. The coffee for the high table at Baraza 2. We will lead you to where Baraza 2 is. Excellency Senator knows where Baraza 2 is, so he will also take us there as a Kenyan and as our host. Thank you. Group photo. We will, delegates, we will also have a group photo. We'd have a group photo thereafter. Yeah. Yes. We'd have a group photo also outside. Mohammed Abdullahi, media. Mohammed Abdullahi, communication. Yeah. Yeah, it's already Sasa. Then protect us. Yeah. Group photo. Group photo, please. Let's proceed. IGAD colleagues, make sure everyone is in that photo. Somalia, Kenya team, South Sudan, we are waiting for you. Ethiopia,